Հայ-ամերիկյան առողջապահական միության անդամ բժիշկների հերթական հավաքույթ fundraising-ը նվիրված էր Արցախի առողջապահական ոլորտի բարելավմանը.
Armenian American Health Professionals Organization held a fundraiser for crucially important cause, providing medical training and continuing education program for doctors and physicians in Artsakh. The family-style fundraising event took place at the home of AAHPO's President Larry Najarian's parents. The hospitality was prepared by the wives of the doctors, as well as Dr. Luisa Kubikian, who is a staunch believer in the mission of AAHPO and makes every effort in supporting the organization's mission.
We all believe in AAHPO's mission in Armenia. We are very happy to sponsor this year. We have Mrs. Kubikian, Mrs. Kazazian, Mrs. Baidar, and me, and Mrs. Hovanesyan. We're all sponsors of this event. We hope that we can train more doctors in Armenia, and we are really grateful to our donors and people that believe in this mission.
This get-together is very important for AAHPO because we would like to continue training the physicians in Karabakh, and the proceeds of this event will make sure that we can continue our efforts to train more physicians. So we are very grateful to our donors, and I believe that we've raised enough money to continue our program.
We would like to bring awareness to get more support because this is a wonderful cause.
AAHPO has been initiating this vital program since 2011, making it one of the most successful undertakings of the organization to the date. The purpose of the program is to help the doctors in Artsakh to learn more about advanced and modern medical techniques available today.
This is just one aspect of how we fulfill our mission, and it's an extremely rewarding, probably one of our most successful projects. We've been doing it since 2011, and what it does is it fills a need, a critical need, for doctors in Artsakh and Stepanakert to learn more about the most modern medical techniques. It fills a gap. Many of these physicians graduated many years ago, and unfortunately, many have not been computer literate, and they can't access medical information. And unfortunately, continuing medical education is a program that really hasn't been going on. So many of these healthcare providers haven't been learning the newest opportunities despite their best efforts to try to learn. They didn't have access. So what this program does is it trains the physicians. We actually have a continuing medical education program. We take them from the villages, from their rural towns. We bring them to Yerevan, where we give them computer literacy training so they can access information on the internet. We also marry them with a trainer. This is a medical physician that has trained in Vienna specifically on how to convey medical knowledge to other associates. They're there for a month and they learn critical skills. So they may learn how to do a C-section. They may learn how to treat a heart attack. They may learn how to treat an asthma attack. They learn things that are very practical in the villages, critical skills that will help save lives. To date, since 2011, we've trained 70% of the doctors in Artsakh. This would be about 213. We can't train all because, unfortunately, there's not enough doctors in Artsakh. So if they leave their home, they leave the village without medical coverage. So we are really just so proud and so happy to announce that because of the cost savings and the decreased administrative costs, we've actually been able to now go into Stepanakert. Instead of taking them from Stepanakert and bring them to Yerevan, we actually are bringing trainers to them where they'll undergo a 6-week course. So this year, in addition to the 40 healthcare providers that we're training, we'll train another 30 from the rural villages that could never make it to Yerevan for their training. So this is extremely rewarding. Our goal is to help all of them, all the physicians. And what's really great about this program, it breaks down barriers. We get to know who they are. When we go on our medical missions, we get to work with them. When we have visiting professors who are visiting Artsakh, they go and lecture and work with them alongside and exchange ideas. We also combine this with hybrid telehealth, where we do Skype meetings. So we can have a physician here in the United States sitting in their home giving a Skype lecture. It will go to about 10 locations in Artsakh as well as in Yerevan. So what we're trying to do is foster these relationships to convey medical information, exchange medical information, and really give the physicians as well as the people they serve, our brethren, the hope for a better future, a healthier future. What's also very interesting is, unfortunately, Artsakh is in a state of war preparedness, and the soldiers are in very big need for health care. Interestingly, our program has only been through the Minister of Health prior to this year. But we are addressing that need. We're now working with the Minister of Defense, and we're now incorporating their physicians, the military physicians, in our program. So this program's been going on for 8 years. It's expanded to train more doctors from the villages. It's expanded to treat the military physicians, all with the same amount of money we spent in 2011. We're very judicious, and we're just so grateful for all of the donations that we received. Each donation means so much and so impactful on many, many people whom none of us will ever meet. But these are the people in the villages, the end users of the product that we help give them.
During the event, the attendees had the opportunity to watch the video, which was sent from Artsakh by Hambartsun Simonian, Deputy Country Director on Development and Health Program.
Dear friends, it's a great honor for me to join this important event and be with so many distinguished colleagues, even though by video conferencing. In 2011, American Armenian Health Professionals Organization came up with a major initiative to organize continuing medical education program for physicians working in Artsakh Republic. The goal of this project is to improve the overall health of Artsakh Republic population through continuous medical education of doctors practicing at local hospitals and clinics by enhancing their professional knowledge and skills, and by providing opportunities to master innovative approaches, methods and technologies, as well as to develop a sustainable communication line between professionals of local and Yerevan-based hospitals. The total number of doctors who have benefited from AAHPO CME program since its commencement in 2011 is 213. This is more than 70% of physicians practicing in Artsakh, and the program is still in high demand. AAHPO CME program is continually proven effective as implementation produces direct impact, the effects of which become more and more apparent over the course of time. For instance, an immeasurable benefit of CME program for the population are the lives it has helped to save through improved medical care. We can proudly state also the indirect influence and impact of CME program. This program is a real opportunity for Artsakh physicians to be in touch with the advanced medical practice of their colleagues in the capital of Armenia. This network between intellectual healthcare professionals, community of Artsakh and Armenia is critically important nowadays, not only in terms of professional development, but also because it has triggered noticeable energy and enthusiasm amongst the people living and working in the frontline under permanent risk. In the meantime, we should also consider the humanitarian influence of this program. Unfortunately, the issue of funding to partake the longer times CME is yet a challenge for providers coming from Artsakh, and the program takes off a big financial social burden from healthcare professionals and healthcare system as well. Dear friends, in April of 2016 showed once more time that war is not over, and Artsakh doctors and hospitals must be better prepared. This is exactly why AAHPO CME program is so critically important. As the necessary development of our program is the on-site trainings. One of them we are going to organize in November with MOH of Armenia and Ministry of Health of Artsakh. 45 family practitioners from different hospitals in Artsakh will underwent the 6-week family practicing training in their working places. It is hard to find the words to express our appreciation to AAHPO, to Dr. Lai Najarian, to Dr. Rafi Ovanesyan, and each and every one of the members. You are saving lives and helping to grow healthy and vibrant population of Artsakh. And of course, I know the AAHPO is doing much more for the local communities in USA, and I'm sure more knowledgeable people will proudly have shared those stories too. In 2019, July, Armenia will host the 5th International Medical Congress of Armenia. I think it will be a great opportunity for each of you to visit and see your incredible contribution in motherland. God bless you.
The program works by bringing the doctors from Stepanakert to Yerevan and pairing them with world-class experts in modern medicine. This helps Artsakh doctors not only to learn about the latest technological advances, but also apply their learnings to provide better medical care to people in villages of Artsakh in many fields of medicine, from C-section to heart attack to trauma treatment and more.
The main purpose for this gathering is to raise enough funds so that we can continue our project in Artsakh for the re-education of the physicians that have not had the pleasure and the possibility of re-education for almost 10 years. It is so essential for us to do that because most of the clinics and the hospitals have been away from the big centers, so the physicians and the staff have not had the possibility for education and updating their education for the modern world. This possibility of the CME, which we work through the Fund for Armenia Relief, is a blessing to all the physicians. We've already had the pleasure of educating over 70% of the physicians who are practicing in Artsakh. But our main purpose is so that we can continue the education so that every 3 to 5 years the physicians can come back and continue this. So everyone that has contributed to this project is a very worthy cause, and we are very grateful for that contribution.
The achievements of this program to date are impressive, with nearly 70% or 213 of Artsakh's medics being retrained, providing much-needed medical service to our compatriots in Artsakh. Without doubt, this important program will continue to grow, thanks to the dedicated work of health professionals of the Armenian diaspora, among them AAHPO members from Greater New York.